because anything can happen. But for now, we want everybody to learn. Everybody should have equal opportunity to learn something, so that there will be no one person who has an excuse why they cannot be pregnant. There is nothing like hopelessness in infertility. The only problem you have is ignorance. Ignorance. Like the person that said she has not been pregnant, she wants to be pregnant. There's no hopelessness. All you need is knowledge. And I'm bringing you that knowledge for free. Right? So, let's go to today's gist. What does, or rather, where does amniotic fluid come from? Where does it come from? Amniotic fluid really does not come from one source. So there is not really one thing I will tell you that, okay, this is the place it's coming from now. It does not come from one source, right? It actually, the source actually changes as the pregnancy progresses. And I will give you those details as we progress. Right? Guys, let's tap on our screen. Let's surpass 10K likes and move on to the next target of likes. Is that okay? Thank you very much. Lovely. I appreciate. All right. So I said as the pregnancy progresses, the source of this amniotic fluid changes. What produces amniotic fluid in the early stages will change as the pregnancy move on, as you progress. So in early pregnancy, that is first trimester, the fluid actually comes from mainly the fluid comes from the mother's blood plasma. Yeah. And it passed through the fetal membrane before you can have that fluid. Yeah. So that's where the first trimester fluid, that is the source, the mother's blood. Yeah. So you see why you cannot play around in your first trimester, because everything you do will determine the overall outcome of your pregnancy, even the after birth outcome of your baby. So the first trimester is the most delicate and very vital stage in your pregnancy. Then as the pregnancy progresses from first trimester, when you get to mid pregnancy onward, yeah, the baby starts to swallow that fluid. Yeah, the baby swallows that fluid and the baby urinates that fluid. I've mentioned that when we're talking about some other things, but basically, when I was talking about who I was asking the question, who taught the baby how to suck when they are born? Some things I just follow come, right? They are follow come. Some things are like they come with the operating system. Yeah. But who taught the baby how to suck? Who taught the baby how to breathe in and breathe out? Who taught the baby how to urinate or even poop? Right? So some of this programming are follow come, right? But again, while they are in the womb, the baby starts to swallow the fluid that's around it. Swallows it. And when it swallows, what does that mean? It means that it is putting its digestive tract into use. So when it swallows, it has to go through the mouth, the esophagus, the stomach, then through the part of the intestine. Good evening, Queen Josie. Through the part of the intestine where it will be absorbed. Yeah. When it is absorbed into the bloodstream, the kidney will now filter out the same water, the same fluid, pass it through the urinary tract down to the bladder. Of course, in the womb, the bladder fills up and empties. So down to the bladder, and the baby pees it out again. So the baby swallow the water, and the baby pee the water. I told the mother this thing one time, and she said, ew. Well, it is what it is, right? So, but again, at this stage, the baby's lung also contributes to the amniotic fluid. Yeah, it contributes to the amniotic fluid, the baby's lung, even though the lung is not in use at this stage, but the baby's lung releases fluid into the overall amniotic fluid. So, yes, the baby drinks the water, the body will process it, and the baby will pee it back. And this cycle is a very important cycle in the overall development of the fetus. Good evening, Asa Kenneth. I see you. You're welcome. Right. So amniotic fluid is not just water. It's not just water. It performs many life-saving functions, like what I just mentioned about the digestive tract, about the urinary tract. Yeah. Right. And if the water is too much or too low, it gives you an idea of these processes I just mentioned. Because the water should not be too much, the water should not be too low by design. If all the physiology is working properly, it should maintain that balance. It should maintain the balance. So why is amniotic fluid so important? Because of the life saving functions it does. So the first thing you should know, why is this important? Hello, I can I don't understand your question. What is she saying? I don't understand your question. What's your name now? Your name is Shaheen. I don't understand your question. Please, you want to ask it again? Anyway, ask your questions when it's time for questions, right? All questions should wait until we get to question and answer time. Is that okay? So that we don't distract other people that are learning. So we're answering the question why amniotic fluid is so important. It's so important because the first part of the gist is, good evening, Dorcas, is for it cushions and protects. Cushion and protection. All right? Cushion and protection. 16 people in the house, please tap on your screen. All fingers on the screen. Let us take the likes up. By the time we start tapping, you see more people will see us and join, and so that they will learn, right? So the first importance of amniotic fluid is cushion and protection. The fluid acts like a shock absorber, right? It acts like a shock absorber. And what does shock absorber do? If there is a trauma, the shock absorber collects the shock, and the fetus may not even know that that even happened. So it protects the baby from external pressure. Yeah, it does protects the baby from external pressure. It prevents injury. That's what the shock absorber do. Prevents injury if the mother moves in a certain way, if the mother falls or even presses their abdomen. You right? Of course, we have several times people may have been involved in certain level of accident. They rush to the clinic. They want to, oh, is the baby okay? Is the baby okay? Sometimes the baby is not even aware that there was an accident. Why? Because of the cushion and protection effects of the amniotic fluid. So don't worry, your baby is well protected. Also, play your part in being careful. Is that okay? And besides that, it helps the baby to move freely, right? Just look at this picture. Can you see that? You see water all around. So the space it creates for the baby is to enable it to move freely. You know, we are talking about this the other day, how that as the brain forms, this as the brain connects to muscles, another part of the body, movement is elicited, right? And of course, this kind of movement will be needed, will be done where there's enough room to extend the hands, stretch out, roll around, and all that. So it allows the baby to move freely. And without this fluid, amniotic fluid, the baby could physically be injured in the womb. As a teenager, is that Christy Label? Christy Label is here. Welcome in, Christy. Hi. As a teenager years ago, I I saw a man who had a kind of depression somewhere around here on his face, right? And that depression looks like a fist, right? You could almost make a fist, put it there, and you begin to wonder, how did it get there? What happened? I've wondered for many years. Of course, I didn't have the opportunity to speak with him one on one, so I couldn't. I was a very young guy. He was a very old man, right? So I was wondering, and my theory at that time was maybe while the mother was pregnant, she was engaged in a fisticuff, right? And maybe somebody punched. But that may not be true because the amniotic fluid will not let that to happen. But it still remains a mystery because I didn't have the opportunity to ask that question. But again, he lived all his life with that impression. He lived all his life with it. So it remains for me to continue to wonder what really happened. But I said all that to say that even in time of trauma, the amniotic fluid around your baby serves as a cushion and protection. So sometimes they don't know that you fell down. Sometimes they don't know that you are suffering the things you are suffering, right? The amniotic fluid also helps the baby to grow properly. The baby needs space to move. The baby needs space to stretch. The baby needs space to kick, to turn. All those activities. I've done hundreds of thousands of scans in my lifetime, right? And I've seen all manner of movements in the womb, right? Those that are stretching like this, those that are moving their hand. Some are trying to stand and push their hands upward. Some are pushing their buttock against their mommy. Some all manner of things. Some that are sucking their hands, whether it's this one. So all those behavior you see in early life actually was going on in the womb, right? Even for guys, those that are holding their John Thomas right in the womb, right? Oh boy, you know, all manner of things you see. But it is essential. That is what the amniotic fluid will help. It helps the baby grow properly. So when there is enough room, when there is enough opportunities to move, well, would you grow if there's no space for you to grow? You wouldn't grow. You wouldn't grow, right? So these movements that the baby or fetus makes in the womb, it makes the muscles grow stronger, right? The joints to form properly. What is joint without flexing, right? What is joint without flexing it? What is muscle without also flexing it? Even you that is an adult, you need to do some exercise to make sure your muscles are in good shape. Even the bones will develop correctly because the amniotic fluid creates that opportunity for that kind of growth, right? Now, if there is low fluid, it means that there's going to be restricted movement. Hi, your name has a lot of things I cannot pronounce. Good to see you. You're welcome. There is low fluid. movement will be restricted. And if movement is restricted, abnormal development will be the case. Right? Antonia, good to see you. You're welcome. Right? So you need adequate movement for proper growth. Right? So that's why I'm always concerned with those people that have very large fibroids and they are pregnant. Well, God will help you. The baby will be all right. But again, the baby is competing with space with the fibroid. So, but don't worry. Just all right. If you're just joining, you're welcome. We're discussing amniotic fluid. So just make sure you grab your pen and paper and learn something. So the third thing that the amniotic fluid would would do is essential for lungs development. I mentioned earlier that even though the lung is not being used, it also has some relevance, and this is one of the most important role. It's one of the most important role. Good evening. If you are just joining, I see you, and those in the FYP, I see you too. Right. So when the baby breathes, right? Because by the way, for those who have gone for, if you've ever done biophysical profile ultrasound before, but if you don't know what I'm talking about, don't worry about it, right? But if you've ever done the BPP ultrasound before, one of the things you see in the report, you see something like breathing movement. Of course, and I told you, who taught the baby how to breathe when they are born? It always has been rehearsed throughout. But in this case, because they are in water, they can make the breathing movement, but it's not air that is going through in and out of the lungs. What is going through in and out is the amniotic fluid. So you see them do things like in the womb. Well, I can tell you because I've seen hundreds of thousands of them over the years. So that's basically what happens, right? Breathing movements. And part of breathing will include the movement of your abdomen and the movement of the chest, right? And that is what forms part of the biophysical profile that your doctor will be interested in, right? So when they do that, the lungs expand, right? And the airways will be, it helps the airways to develop. No, it's not air that is flowing, but in this case, it's fluid that is within. So that movement of the fluid is helping the airways to be developed. It's also helping the lung tissue to mature so that by the time the child is born, there is no hassle to whether the lungs is strong enough for breathing. So the lungs does not begin to try to breathe when the baby is born. No, the rehearsal has always been melody. Melody, enjoy your life, but when the trouble comes, you're on your own, right? Anyway, without enough fluid, one thing is sure, the lungs may not develop well. Gifty is here. Without enough fluid, the lungs may not develop well, and you may have um, pulmonary hypoplasia, right? Basically, that's what it means. That's just what lungs that is not properly developed means. Pulmonary hypoplasia, which is actually a life-threatening condition, right? So you can begin to see how important this water is. Yeah, Mirage is here. Mirage, good to see you. Right. So the next thing, the amniotic fluid, right, maintains and or stabilize. Let me put it in a proper English. The amniotic fluid maintains a stable temperature. Yeah, that's the way to put it. Amniotic fluid maintains a stable temperature. Why? Because amniotic fluid will keep the baby warm, make sure that room temperature is maintained and stable, like it would be if for any reason the baby has to be in an incubator. By the way, the womb is an incubator. so so it has to have the necessary temperature and and stability, right? And by the way, how many of us have seen that AI womb that has been that was in the news one time? They've created an AI womb for those women who don't want to carry babies, right? Don't want to carry babies. There is AI womb that can help you. But how proper that is another story altogether, right? But I know there are those. But I think that if you have medical condition that cause you not to carry your own baby, you may take advantage. But if nothing is wrong with you, if nothing is wrong with you, and you say you need an AI to carry your baby, something is really wrong with you, right? Something has to be wrong with you for you not want to carry your own baby. It's a marvelous experience. Forget about all those shouting. If they were telling you the truth, women will say that oh, labor pain is this, labor pain is that. If it is that true, hmm, why do they always want to go back to become pregnant? So is either they are lying to us or there's something we don't know yet, right? Well, labor pain is very painful, but it's just that nature did it in a way that after the delivery, you may not remember the pain anymore. So, but it's worth the experience. It does something to you, changes your life forever, right? Right. So the AI womb is a thing, right? It's a thing. So you want to go and check it out. The baby will also be AI. No, not necessarily. The baby may not be AI. It's just an advanced another step forward in the IVF technology, in the ART technology rather, assisted reproductive technology, right? It's just another step forward. So instead of looking for a surrogate, the AI will replace the surrogacy, right? So just look it up. Just be aware of what's going on. It's not a popular thing yet, but trust me, we're getting there. All right. So it's also amniotic fluid also prevents the cord from compressing. Remember, the umbilical cord carries blood supply to and fro, right? Takes blood from the fetus and it brings blood from the placenta. So you should not, hey, my crush is here. Right? So nothing should obstruct that flow of blood, right? So the umbilical cord definitely will need room to float freely in the fluid, right? And enough amniotic fluid would mean it will prevent compression, it will reduce oxygen, it will prevent distortion or reduction in oxygen supply, right? And even fetal distress. That's why it's always a thing of concern when there is uh, there is scanty fluid. Because if there's scanty fluid, there's going to be compression of the umbilical cord, and that will mean compromising the the flow of blood, and that's not good. So your doctor is racing against many things, not just the one you are concerned about. Yeah, compliment of the season, my crush. So without enough fluid, the cord can actually squeeze, and that compromise would happen. All right. If you are here, you're active. Please comment in the comment section. Understood. If you understood anything I've said up until this point, I've given 5 points already. If you understood anything, just type understood so that I'll know that I'm talking to active people. And if you have not followed me yet, this is the time to follow me. If you have not followed me yet, all of you having questions, hold on with your questions. We are getting close to Q&A session, all right? And if you are here, you have not dropped a heart me, drop a heart me, drop a heart me, right? All right, let's move on since I have a lot of active people today, right? So the amniotic fluid supports digestive system and urinary uh, uh, tract development. Yeah, even your renal system. Now, when the baby swallows fluid, as I mentioned earlier, what happens? That swallowing of fluid is where the gut learns how to work. So that water you see is not just to make your baby bump come out. No, it serves a lot of physiological, protective, and even physical functions. So when your baby swallows the fluid, the learning of digestion starts from there. Is that okay? Also, the kidney becomes mature, or rather gets matured by that process of swallowing. Now, when it swallows, the digestive system takes it in, sieves the water into your bloodstream. The water in the bloodstream will be filtered out by the baby's kidney, right? So as baby's kidney is doing its filtration process, that is how the maturation of the kidney occurs. There are several things to say, but I will say that to the professionals so that I will not kill some of your spirit here, right? So that is how urine production begins. And of course, swallow the water, pee the water, swallow the water, pee the water. That is how the volume is maintained and sustained, right? And this is also how your doctor would know that the baby's kidney and GIT, that is the gut, is functioning properly. If for any reason, Stephen is here. No, Stephen, when we as professionals are ready, we'll go to our own class. We'll say all those things there. But I'm speaking to a global audience of all manner of people. So I will just limit the discussion to the surface. Is that okay? So, like I was saying, this is how your doctor knows that your baby's kidney is functioning well, your gut is functioning well, right? If for some reason there is too much water, something is wrong. Remember, there's supposed to be a balance. Of course, your doctor or your sonographer measures the quantity of water, and there is the volume that is expected. So now it's too much. There's always a reason why it's too much. Or maybe it's not even enough. It's too low, scanty, or even absent. There's always a reason why it's absent or too low. But for what I just said already, it already gives you an idea. It may just be a problem with the gut or the kidneys. So for the general public, hold on to that information, and that will be enough for now. So there are several ways to measure this thing, but it's not for you to worry about how the doctor measures it, right? I'll just tell you the grammar they use when they when they diagnose you. I'll just mention the grammar so that the next time you hear it, you understand that's what they're saying. Normal fluid is normal fluid. But when you begin to hear something like, who is that? Gifted gift. Gifted gift. Ask your question when it's time for Q&A. Right. So when you begin to hear things like oligohydramnios. Oh, really? What's going on? Oligohydramnios actually means too little fluid. The word oligo is scanty, few, right? Hydramnios is water. So few, scanty water. Is that okay? Then when you hear something like polyhydramnios, poly means many, right? Water. So too many water. So when you see any of those things, you just know that's what they are saying. And there's always a reason. And your doctor will try to find out why is it so? Why is it not normal? So that also will prepare them for what to expect when the baby eventually comes. Is that okay? All right. So the effect of oligohydramnios when it's too few. This is what happens. This is the effect of fluid that is too few. The fetus will have poor growth. The fetus will have poor growth. The limbs may be deformed. It may have deformities. Remember, if there's enough water, there's room for stretching, and so may not compulsorily so, because we want to now know at what stage of pregnancy did this limitation started. So several things, but just to give you a general idea. So the effect of oligohydramnios will be poor fetal growth, limb deformity, maybe even lung underdevelopment. Remember the function of lung I talked about? Yeah, and there's also the increased risk that will be during delivery. Such have increased risk. So your doctor will be very careful. The effect and impact of mm, okay, what can cause this oligohydramnios, right? Uh, Placenta insufficiency can cause it, right? High BP can cause it. Dehydration can cause it, right? Uh, Leaking water. Those women that have, for some reason, there is a rupture of their membrane and the water is leaking out. Of course, means water is being lost. So that can cause it. And kidney abnormalities in the baby can cause it. I hope that is clear. If it's clear, just type clear. Let me be sure I have some active people. It's like the network is fluctuating, yeah? If it's clear, just type clear. Let me be sure I have some active people in the house. Clear. All right. So that's what can happen in oligohydramnios. That's scanty water, right? It can happen due to um, placenta insufficiency, high blood pressure, dehydration, leaking water, that is rupture of the membrane, and even kidney abnormality. Ah, who is this? I should explain again. Be careful, right? So, what about polyhydramnios? Polyhydramnios. The causes of polyhydramnios will include maternal diabetes, where the mother is diabetic. Is that okay? Maternal diabetes. A problem with the fetus, the baby's inability to swallow the water. Remember what I said. Part of what they do normally is to swallow the water. So when there's a problem with the baby swallowing water, it can cause polyhydramnios because the swallowing and the peeing is the balance that is created. So if there is no swallowing, the water volume will be increasing because the baby will be peeing and get to a point where you cannot pee because if you don't swallow, there's no water to pee. So you can see how the whole system can dramatically shut down because of that singular thing. So that's why it's a very important aspect of your pregnancy, right? It also gives an idea that there is a gastrointestinal blockage. Yeah, it can happen in twin pregnancies. It can happen in twin pregnancy, and also when there is infection. Yeah, also when there is infection, and the effect of all these things would include preterm labor, preterm labor, right? Even cord prolapse. I will not explain that. Maybe in another discussion, we'll revisit that one. Cord prolapse, even abnormal presentation. Presentation, normally babies are supposed to present with their head downwards, right? But it can be presenting with the side, the hand, the buttock, the leg, just abnormal presentation. That's and it can even cause breathing difficulty for the mother. If you're struggling to conceive, there is no hope lost, right? Caro, I'm talking to you. There's no hope lost. All you need is knowledge, and God will help you, right? All right. So these are the things I can just mention quickly for you in the oligohydramnios and polyhydramnios. Is that okay? So someone asked a question: Can a mother influence amniotic fluid levels? So can you influence the amniotic fluid level? The immediate answer to that will be to some extent. Yes. To some extent, yes, the mother can influence it. And the helpful things that you can do, right, is to make sure you are adequately hydrated, make sure you eat well, nutritious food, good nutrition, make sure you manage your blood sugar. Remember, we talked about it yesterday. Manage your blood sugar, treat infections early. Yeah, treat infections early, right? Also attend your antenatal care regularly. If you do all these things, you'll be able to support your baby have an adequate water around itself. Mrs. V, what can you do as per what? I don't understand your question. So drinking water can help. It does help, especially in your mid if there is mild low fluid cases. So make sure you are hydrated adequately. Is that okay? All right. So I think we should take some questions. We should take some questions before I go. Well, okay, I'll have 1 hour of questioning. So if you have questions, make sure you jump in now. But before we begin to take the questions, remember that amniotic fluid um, feeds. Amniotic fluid will help your baby grow. If you have too little or too much amniotic fluid, it can cause problem, right? If you have regular scan early enough, it will help you detect if there are issues. So you want to take your antenatal care, your doctor will send you for ultrasound. So proper care and correct management will help you handle some of the problems that may arise. So these are the things I just want to make sure you catch before we take questions. All right, please let's ask. Before we go ahead, okay, let me bring these guys up first. Remember our New Year's Day episode. We're going to be talking about recovery time. Please invite all the men you know to join the live stream because we're going to be answering why some men have more rounds than some others. and we're going to look at all the factors that can cause it. So that by the time we enter 2026, no man should have any excuse not to be very useful in the other room. So 2026, besides naming ceremony, people should be happy in the other room. Right. So you see, I care for everybody, right? So who is coming up? Come up, let's answer your question before we go. While we are waiting for them to come up,
Wait, waiting room full like Sunday church.
please send
People
your
we
request
got
to
the
come
pain
up.
and search. Some they smile
If you
fake,
have a
some they
question, send
cold.
your request to come up.
Everybody they hold story untold. She rub her belly, him the pace. The last can no show any trace. But still they come, still they pray. To the feet be the miracle day. Waiting room full of silence.
Hello.
Hello, good
Good
evening, sir.
evening. Merry Christmas to you.
Same to you, sir, and your family.
Very well, thank you.
Yes,
Go
sir.
ahead.
Yes, sir. Please, on the 8th of the December, I went for a test and a scan, a blood test, and it was positive, and the scan said under 4 weeks. And then on Monday, which was on the 22nd, that was after 2 weeks. I went back for another scan and they said they weren't seeing anything. So I don't know what the problem could be. And I was also put on a cyclogest because of previous early loss I had. So the cyclogest finished day before yesterday.
Mm.
So I don't know if I'm to repeat the scan or I don't know what to do at this point. So that's what I want to ask about.
Between the first scan and the second scan, how many
Yeah,
weeks or how many days?
2 weeks.
It was 2 weeks.
Yes, sir.
When you say they didn't see anything, I would have loved to see the report. Maybe you're not reporting it to me the way it's, you know.
They said they didn't see any sac at all.
Mm,
The first one I did on the 8th, they said there was a small gestational sac.
hmm.
Then after 2 weeks, I went back. They said they are not seeing any sac at all in anymore.
So, what did they advise you?
They just said that I should repeat the scan in another 3 weeks. So,
Mm,
but I noticed this evening that I started having a little spotting.
hmm.
Yes, sir. So that was what I wanted to inquire about.
Okay, please go back to your last normal menstruation, please.
The last,
Your last normal menstruation before this
it was
episode,
on November 6th.
November 6th.
Yes,
So when
sir.
did you do the test?
I did it on December 8th.
Okay. And today is 26th.
Yes,
Please,
sir.
if you just wait for the rescan. Is that okay? Where are you? Where are you streaming from?
I'm in Accra.
Okay, so just wait for the rescan.
Oh, okay.
Yeah, wait for the rescan.
Okay,
So
but
if
if the spotting gets more, maybe I'll just go back to the clinic then.
yeah, if it's becoming unusual, if the spotting is becoming unusual, yes, you need to go back to the clinic. Now, I'm sure you were not here when we discussed the difference between spotting and implantation bleeding, right? I'm sure you're not here.
No, no, I just joined. No.
Unfortunately, where have you all been, right? There's so much information that we share. You see, the reason why I ask people to tap on their screen because there are people who need the information that needs to see us. All right,
Yes.
so fingers crossed. The spotting, if it's becoming more, it becoming abnormal, go to the
Yes.
clinic.
Okay,
However,
sir.
I will be more interested in the follow-up scan as recommended.
Okay, sir.
Yeah, so I don't think I'm losing hope on your matter.
Okay, sir.
All
Well, I
right,
was
so
worried why they saw it at first and now they don't see anything at all.
no, don't worry, don't worry, don't worry, don't worry. I know your mind is on the matter. Oh, it was there, it's no longer there. Calm down, calm down, calm down. Nobody has given you any verdict yet, right?
Yes.
So let's wait for the follow-up scan. Then let us see what happens. So I'm sure you'll give us feedback when it comes because
Thank you very much, sir.
we'll be interested in that feedback. Yes, you're welcome.
Thank you very much. Bye.
All right, so please send your request if you have a question. I see some questions in the comment section. Um, I don't use glasses. Some of your writings are too small, but you want to send a request. It's better heard than read, right? Um, it's coming up. Take the advantage now because by December, we can only take questions from those who meet our criteria. Well, with this, no, not December, by January rather, only those who meet our criteria. But for December, we are doing bonanza. Hello, the room. No, your background is so you are still enjoying Christmas, I think.
Hello, good evening, sir.
Hi, good evening.
Merry Christmas, sir.
Same to you. I hope you're enjoying yourself.
Sir, can you hear me well?
Loud and clear. Go ahead.
Okay, sir. Uh, this is my first day of coming across you online,
Where
and
have you been?
this is my first day of seeing you on TikTok. I just came across you now, and I was listening to the lady that just asked you a question, and I decided to give you a follow. I like how you responded to her, and I listened after it. I said, okay, let me ask my own question. So it's a privilege and unfortunate to meet a kind daughter like you, sir.
Thank
Uh,
you.
Thank you, sir. So a quick one. A quick one. Currently now, I'm having some little challenges.
What's the challenge?
Uh, my baby is just 4 years, and I've been trying to conceive. And I normally have a miscarriage due to the reports given to me that I have a PCOS or hormonal imbalance. I don't know. But the reports came after childbirth.
Hmm.
But last month of November 24th, I saw my menstrual cycle, and this on 24th of December, I was supposed to see it also. It did not come. I only spotted on that 24. I spotted yesterday, and the way the thing was doing me, I felt maybe I'm having a malaria and typhoid. I have to go and buy malaria drugs and typhoid drugs. I said that because I did not really put my mind in there, though I'm praying for it.
So when I came across you now, I just say let me use the privilege to ask you this question. What could be the reason why it did not reflect on 24th? Because October was 24th, November was 24th, and I was happy that it has started becoming regular, unlike before. Hopingly, I could see it this 24th December, but I did not see it. So I just let me use this opportunity to grab this opportunity, meeting you on this platform to ask you these questions.
So
If I can get an answer to what is really going on with me.
did you do any test?
Thank you, sir.
Did you do any tests?
No, I've not done anything. I'm just lying at home. I said maybe by tomorrow or Monday I will go to the hospital, but this you go to the test, they say negative because the miscarriage I had this January. I bleeded all through November last year. I went to the hospital, they say negative. I went to scan, they say negative. December I bleeded. The bleeding continued to December. It will bleed, it will stop. I went back again. I told my gynecologist, like this thing is pregnancy. He said, go home. Stop disturbing yourself. It's not a pregnancy that I should go and run test. I went to test. They said nothing is found. January I bleeded like 3 good weeks. They have to place me on injection to stop it. It could not. First week of February, somebody took me to an old hospital. When I got to the hospital, the doctor said, no, this thing could be either fibroid or miscarriage. I said, sir, I have been to several scams, up to 4, 5. They said they did not see anything. So what is the possibility that I will be pregnant? So when the man run me scan, he realized that I was pregnant. I said, no, 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 no. The bleeding is too much to control. That I have to enter theater. And it was removed because I told him my faith can no longer carry it. He should remove it. So ever since then, my major cycle have not really been stable. And I won't lie to you, I just remove my mind because I'm tired. Either you go scan, they say negative, you run test. If I can be pregnant and scan say negative, test say negative. So in this situation now, I've just decided to be at home and be watching it. So, but when I came across you this night, I just let me try my faith. Maybe you can give me an advice that work out for me. That's why I came online to ask you this question. I'm sorry for taking much of your time, but no one knows the day God will visit his or her challenges. That is why I said, let me grab this opportunity to relate it with you, sir. Thank you very much, sir.
Okay, okay. Thank you for first the kind words and for the details you have given us. All right.
Thank you,
So
sir.
first and first, I would like to be sure what you were diagnosed with. Is it PCOS or hormonal imbalance? Because you were not you were not giving me something concrete in that area. Were you diagnosed of any of those, or you were just suggesting it yourself?
Before I got pregnant, because I got married 2019, but before I got pregnant in 2021, I was having miscarriages. What
Mm-hmm.
they saw was hormonal imbalance.
Mm-hmm.
Hormonal imbalance is what sometimes they will write hormonal imbalance, sometimes they will not write it.
Mm-hmm.
They will say everything is okay. But I remember I conceived, I was given a litrozili something tablet that make me to conceive and I give birth to a baby boy that just clocked 4 years, 2021. But
Mm-hmm.
immediately after the childbirth, I went back to the hospital all through 2022. Everything was normal, nothing like hormonal imbalance, nothing was POS, PCOS. But when I tried conceiving again 2023, I started hearing the story of PCOS. I will go to hospital within one certain period, they will say PCOS. I will go again, they will say hormonal imbalance. I will go again, they will say they see nothing. So I stopped going. I won't lie to you. Because whenever I go and return back, my life don't remain the same. I cry all through. It looks like I want to commit suicide. Someone who get married to an only son and there's pressure all around. I won't lie to you.
My God.
Sometimes it makes me to give up in life. Like today that I came across you, I've thought about it. I said, God, I'm getting tired of everything before I came across you on this platform. So I cannot really tell you. If I should go tomorrow now, they might say they didn't see anything. If I go up a few months, they say PCOS.
Okay,
But
calm
what I
down.
know is that since I was born, even when I clock 18 years, I have never menstruated for complete 12 months of my life. I would say since I started menstruating, normally 6 times a year, 7 times a year, 8 times a year, and I normally have heavy flow. That has been my history of my cycle.
Okay. So right now the most important thing is your your menstruation has delayed. That's what you have said, right? So
Yes, I
what is
supposed to be on the 21st. I spotted 23rd, 24th, 25th, but not now. But I still feel like I'm having spotting, but it's not dropping. But I'm feeling it within myself.
the reason why you need to confirm first? But I want to know your age bracket. Are you in the 40s, 30s, or 20s? What's your age
I'm
bracket?
just, I just clocked 32 plus.
So you're in your 30s.
Sir?
Um, I said you're still young.
Okay.
So first, we need to rule out whether you are pregnant, right? So that's the reason why you must do the test, right?
Okay, sir.
When
Okay,
you
sir.
do that one, whatever the result is, that's when you go to the next phase of the gist. If
Okay, sir.
irregular menstruation or delayed menstruation can be caused by several other things besides pregnancy. Is that okay?
Okay, sir.
Also include this one you are saying that you are already tired. That is mental emotional stress. So you must face fertility with positive mindset and 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 expectations, right? So first, let's clear the part of pregnancy. If you are pregnant, thank God. If you are not, then we'll go to the next phase of the gist. Is that okay?
Okay, sir. Thank you, sir.
Yeah. So I'm sure you give us feedback on Monday. I don't, or maybe send me a DM because I don't live stream on weekends.
Okay, sir.
Yeah. So if you want to send me, I want to know, then we can advise you further. Is that okay?
Yes, sir. Thank you, sir.
Good. God bless you.
I appreciate. God bless you, sir.
You're welcome.
More grace, sir.
Thank you very much.
Thank you, sir. Nice meeting you, sir.
Yeah, good to see you. We'll see more of you, right?
Thank you, sir.
You're welcome.
Bye, sir.
Who's asking a question? Ask your question now. Because if you come to my DM, you're going to pay.